right, thank you, Chad. You know, the College of Charleston is launching an exciting new concentration for their degree completion program. Ashley Reiser and Godfrey Gibbison are here with the details on the new program for healthcare and medical services management. Guys, welcome to Lowcountry Live.
Well, thanks for having us.
Thanks for being here. So I want to start with you, Ashley, and just tell me more about what is the program for professional studies or the college, and you know who is this suited for?
So the School of Professional Studies launched in January, and we work with both our degree completion program for adult students as well as our Center for Continuing and Professional Education, which offers our non-credit programs. So our degree completion program is the Bachelor of Professional Studies, and we have been offering 3 concentrations: organizational leadership and management, applied communication and information systems. And now we've just launched our healthcare and medical services management.
That's great. So you guys are growing and expanding, and you said the new one is healthcare medical services management. So Godfrey, tell me more about exactly what that is.
Right. So this concentration will teach folks about the business side of healthcare. There are lots of people who understand the clinical side of healthcare, who are currently working in healthcare, and may want to have a career more on the business side of healthcare. So in this concentration, we'll teach you about who provides care, who pays for care, what are some of the emerging issues in healthcare, like the Affordable Care Act, issues such as patient-centered care or patient advocacy. These are new trends in healthcare. If you're working in that industry, you need to understand what are the new issues that are emerging in healthcare. So, and we also teach you a lot about the laws and regulations that govern healthcare. There's a complex set of laws, both state laws and federal laws and regulations that govern healthcare. And those kinds of issues will be covered in this new concentration.
And I'm sure with all the changes, as you said, this is only a booming, growing industry.
It is. Healthcare is a large, 1 out of every dollar in the United States that's produced is produced in healthcare.
Wow.
It's 1/5 of the economy. In the Lowcountry, healthcare is about 15% of the economy here. There are lots of people who work in healthcare, and that's going to continue to grow. You know, this is a retirement destination, and that means healthcare follows retirement hubs in the country. So a lot of people are employed in healthcare. A lot of the jobs that are now announced in healthcare are more on the management side of healthcare, on the leadership side of healthcare. And a lot of clinicians progress from the clinical side into a managerial role.
And you had mentioned someone who's maybe currently working in healthcare and wants to move more to the administration. But could someone who doesn't know anything about healthcare move into this program, or do you have to have a healthcare background?
So we would prefer if people have a healthcare background, but you could move into healthcare.
If this piqued your interest right now, you could look into
you could move from there into healthcare, or if you don't have a clinical background, but you're still working in healthcare. There are lots of people who work in different layers of healthcare. It's a very multi-layer industry, and there are people working in healthcare who don't have a clinical background, but would also be good on the managerial side or the teaching side of healthcare.
That's great.
So this would be attractive for somebody who, you know, think they want to break into that industry or make a transition into that industry.
And Ashley, how long is the program? I mean, it sounds so complex. Like, how long are you going to be in school for this?
Well, it depends, and it varies from student to student. We do a lot on the front side of working with transfer credit and giving students an idea of how long it would take them to finish the entire program, so that folks can have a good understanding of what they're getting into.
Yeah, and when and where are the classes offered?
They are offered face-to-face, as well as a hybrid model, so half in class, half out of class, as well as completely online. And the classes are offered in the evenings, weekends, at our North Charleston location, so they don't have to go downtown.
So that's great. Even if you currently have that healthcare job, this is something you can do in the evenings to work towards that goal.
Absolutely. And one of the things that we do is that we offer courses right throughout the year. So we do fall, spring, and summer. So you don't, if you know, the pace is really up to you.
If you can only take one class at a time, you guys work with that.
You're fine. If you can, exactly. The pace is really up to the student to figure out how they can get to the program.
Great. Well, you guys have certainly piqued my interest. Where do people go to get more information? And is there a deadline for applications for this?
Yes. So deadlines for summer are April 1st.
And so get on it right now.
Yes. That's in 2 days.
Correct.
And then for fall, July 1st.
Okay.
Then they can go to our website to find out more information or to contact me to start talking about transfer credit.
All right, and that's bps.cofc.edu. Thank you guys, both of you, for being in Lowcountry
Thank you.
Live. Good luck with the new program.
Thank you very much.
And we will have more just in a moment right here on LCL.
Thank you very much.